my very favorite ways to use AO2 Clear in my treatment room are to decongest the skin, add oxygen, help with acne and rosacea, as well as peri and menopausal skin. By the time we're 50, the oxygen in our skin actually reduces by 50%. This is why you'll often hear clients talk about their skin kind of looking dull. It just is missing that life, that je ne sais quoi. And I find that AO2 Clear adds that back and then helps me to address any sort of inflammatory skin conditions like acne and rosacea and pigment. AO2 Clear boosts healing, calms inflammation, and patients leave looking less puffy and clearer overall. For my rosacea clients, I always have them using cream cleansers that are more gentle on the skin and keeping it calm. So at nighttime, I'm gonna have them double cleanse with these cream cleansers, follow with AO2 Clear every single night, and then follow with the active of their choice. I love mandelic acid or some sort of gentle acid-based exfoliation, following with a moisturizer, and then going to sleep. You want to keep it pretty simple with rosacea-prone skin, but AO2 Clear is an absolute must. When it comes to acne, it's a very complicated issue. We have inflammatory acne, we have acne that's derived from too many dead skin cells, or oily skin, or lots of hair follicles, or sometimes it's from sensitivity or over exfoliating. So it's important to know which condition your client has. In any of these conditions, I always recommend AO2 Clear because it hits so many different points. It's gonna help speed up that cell turnover, it's gonna help oxygenate the skin, and therefore making a completely uninhabitable environment for acne to function. It's gonna kill the bacteria, of course, and it's gonna help keep the skin calm while they're trying these more intense actives to fight the acne. This has completely eliminated some of my clients' inflammatory acne, even when they weren't super consistent with any other part of their routine. One thing I really love about AO2 Clear is that it's safe even for super young clients. I have clients as young as 9 years old in my practice, and even they can use AO2 Clear. If I have a client who has more sensitive or dry acneic skin, I will have them use this organic sponge and really pat the product into the skin like so. You really don't want to go too rough with these clients, or especially if they have acne paired with rosacea. Now, when it comes to clients who have thicker, more oily skin types with acne, maybe they're prone to ingrown hairs, a lot of men, I will have them actually use the organic sponge with a little bit more vigor, sort of exfoliating the skin as they go and really getting into those hair follicles like around the beard area. So for my clients with hyperpigmentation or melasma, inflammation is the root cause of all sort of pigment issues. So AO2 Clear is a great product to use in order to achieve the goals that they need to lift pigment. In order to lift pigment, we have to get a little bit aggressive with those actives in our protocols, both in the spa and at home. So it's gonna inflame the skin a little bit, which as a professional, I'm okay with because there's a goal at the end of the line. The issue is some people's skin can't tolerate the amount of exfoliation that's required to lift pigment. So AO2 Clear is going to keep the inflammation down, keep the skin calm. It's also going to help speed up that cell turnover and allow for greater product absorption so that those actives can get where they need to go into the deeper layers of the pigment. This will also help those clients with a little bit of a muddier appearance to their skin feel clearer and brighter. So when it comes to post-treatment care, I do keep AO2 Clear in my arsenal. After microneedling, I tell my patients to go home, give their skin a little bit of a break. I actually want some of that inflammation in order to get that collagen to be boosted. So I will have them use AO2 Clear after 24 hours to calm the skin back down. If they have any residual redness, it's gonna help calm that down and make their skin look better a lot faster, and therefore reducing the downtime with microneedling. Same thing with lasers. If I perform a laser treatment on a client, sometimes that can disrupt the barrier function of the skin. I've even seen some perioral dermatitis or eczema come up from these, and AO2 Clear really helps to clear those conditions very quickly. In as little as 2 days I've seen in my practice, it will help that eczema, that perioral dermatitis, and to help get the oxygen flow back to the skin.